first method obviously is by syringe, by hand. That's something we know, it's very common. And then we went on to modify that syringe and put it on the end of a stick. We'll screw this pole syringe into the pole, give us a bit of a extension. Screw this in nicely. You can see we've got a needle here, a nice sharp needle. Place that inside, and we've got a little tool here to place that needle nicely on the tip there. So we've got just the needle sticking out. You can see that needle sticking out there. This is to press against the skin. You see, if we were to just squirt, it will just press against the skin. So it's a sort of a jabbing action. Just push fast and goes through. And we can fill this with the various drugs we want to. And there's some indication of how much drugs there is. So this is just a nice pole syringe for a cat or something. This is a very short one. And then we go on to our slightly larger one, which is also, you can extend this one. Just give you, it's telescopic, gives you a bit more reach. It just needs an adapter to work with the smaller syringes. So got that on there. And then we've got this. This will give you a very, very nice extension method to jab a giraffe or something at distance. You can see there we can poke our giraffe. And then we've even got the longer one. This is way too long to capture the whole length here on there. But this is just something we can use, and it works very well. So that is the first instance of how to get medicine in. It's a very simple method. We call it a pole syringe, and it's something very handy even for guys that's not doing wildlife, that's got a angry dog or something like that wants to bite them. This is the system. And what's nice is this outer plastic can just be replaced if something did bite on it or crush it or something. So we do get some feisty animals. So that's your pole syringe. Then we're going to move on to the flying syringe, if you want to call it that, or dart. This is the most common one. This is a 1cc 3/4 inch wide dart. This dart is the wide barb is actually one that sells the most and gets used the most. It can be shot from anything from very close up, a few meters to 100 meters, and it will fly straight and direct, and it will deliver the drugs into your animal at those distances. So this is a very, very trustworthy type of dart. The orange tails are cartridge fired, so the normal .22 blank will take this dart through the barrel and push it towards your animal. So a very common one. This is just a modification. It's just a screw-in needle. So this one we'll use an elephant, rhino, and hippo. That is the one we'll use there. You get various lengths and things. Now iterations of that. This is for your CO2 or air-fired rifles. It's very thinner barrel. You can see we can put them in very thin barrels, and we can just blow them by air. This is a bit less traumatic on the animal, so you can use it maybe in monkeys and zoos and things like that, and this will work. Just to show you that we can also go and do rhino with those darts. These are actually specifically rhino darts in that small guns. It will work quite well. And then what we have here is one of our very unique darts. These are marking darts, mark and inject, or inject and mark rather maybe. Now how they work is in this front compartment in front of this cone is your medication compartment, and you'll fill them in the normal way, and they will be shot and they will hit the animal. And what will happen is this front compartment will inject 95%, and once it's injected 95%, the spacer at the back would have passed the holes inside the cone. You can see them if you really try. Those spacers, once it's passed here with 95% drug delivery inside your target, it will open up this cone, and ink will come out, and it will mark ink on the body or on the skin of the animal. This is a very smart way of vaccinating when you've got 300-400 animals, to leave a mark on the animal, and you know for sure that drug has been administered, and you can confidently carry on with your work, because a lot of these darts, they will mark regardless of drug being injected or not. And this is actually a biopsy dart. So it's got something in there to retain the meat or whatever biopsy you're getting, so that goes in there, and this will hit the skin. It will punch out the meat and things. This is quite a heavy dart because you want to now pull on that skin or meat or muscle. But what we've done is we've created a little spring here. So as this compresses and we've got the momentum, will compress, punch out and just break and tear the muscle, and then hopefully we'll just have that little bit where it wiggles out and you can go and collect. We also have a variation where there's a marking fluid also sprayed onto the animal, so you also know that that animal has been biopsied, giving you good confidence that those things are happened. So that is in a nutshell.